The abdomen houses a large number of vital organs that are not well protected by skeletal structures. Injuries and acute distress to these organs can occur from a wide range of incidents. Blunt trauma, lacerations, impaled objects, projectiles, and disease can all contribute to severe damage to the abdomen. When faced with an abdominal emergency, you must be able to quickly assess the nature, severity, and extent of the condition and take immediate efforts to stabilize the patient. In this program, we will present the kinds of abdominal emergencies you are likely to encounter and how to provide emergency care for them. The training objectives are to present the signs and symptoms of and care for acute abdomen, to present the causes of and management for gastrointestinal bleeding, and to demonstrate care for abdominal injuries. Acute abdomen, also known as acute abdominal distress, is the sudden onset of severe abdominal pain. Any patient with symptoms of acute abdomen requires immediate medical attention. There can be multiple causes for acute abdomen, and they can range from indigestion to serious medical emergencies, such as appendicitis, intestinal obstruction, and complications from pregnancy. Because you may not be able to diagnose the root cause of the emergency, you must take all complaints of abdominal pain extremely seriously and activate the EMS system for immediate help. Keep in mind that the location of the pain does not necessarily indicate the location of the problem. The pain associated with acute abdomen can spread out to other areas of the body. This is known as referred pain. It can appear that pain is originating from one area when it is actually referred pain from another area. For example, if your patient is also complaining of pain in their back or shoulders, this may be related to a problem with the liver. Referred pain results because nerve pathways leading back to the spinal cord share pathways with nerves that signal pain in other areas of the body. The signs and symptoms of acute abdomen commonly include abdominal pain, nausea and vomiting, guarding of the abdomen, rigidity, and distension of the abdomen. After conducting your initial assessment and sample history, use the mnemonic OPQRST to determine the condition's onset, provocation and palliation, quality, region, radiating pain, severity, and time. After gathering this information, continue gathering history related to the patient's condition. Inquire whether the patient has been experiencing fever, chills, or unusual urination or bowel movements. Ask when the patient ate last and what was consumed.
Did that stay down at all?
If the patient is female, you should also ask about her menstrual cycle, pregnancy, and birth history. Thoroughly document the results of your assessment and perform a physical exam. Inspect the patient's abdomen, noting any distension. Look for any pulsating mass, which could indicate the possibility of abdominal aneurysm. Palpate the abdomen only if there is no pulsating mass. Use firm pressure, feeling for any pain or rigidity. Inquire whether the patient feels tenderness or pain as you palpate. Normal findings would include an abdomen that is soft with no tenderness present. Abnormal findings include nausea, vomiting, and diarrhea. Note if these symptoms are excessive or if the patient reports that blood was present in the vomit or the stool. Other abnormal findings include pain, signs of shock, and fever. To manage an acute abdomen, first address any life-threatening conditions involving the ABCs. Make sure you have activated the EMS system and provide care for shock. Abdominal emergencies include a high risk of vomiting. Airway maintenance is key. Be alert and prepared to provide suctioning in order to maintain an open airway. Provide oxygen if permitted by your local protocol. Continue to monitor the ABCs. Encourage the patient to assume a position of comfort. She may already be in a guarded position with arms folded across the abdomen and the knees drawn up. Suggest that she may experience a reduction in pain by lying on her side with the knees bent. Use this position only if shock or airway complications are not present.
One more.
If they are, position the patient accordingly.
How's that, sir? You feel comfortable?
Do not allow the patient to have any water or other liquids.
No, that's not really a good idea, Sarah. We want to go ahead and keep your stomach.
Be alert for vomiting. If the patient does vomit, save the vomit or emesis for EMT analysis, avoiding direct contact with it. Keep the patient at rest to reduce anxiety and provide reassurance while you wait for further assistance.
Medic's on the way. We're going to go in and take samples to the doctor.
I'm in here.
One acute abdominal condition you should be aware of is gastrointestinal bleeding.
Hi there, sir.
Gastrointestinal or GI bleeding can occur anywhere in the digestive tract, from the esophagus to the rectum. Common causes of gastrointestinal bleeding include ulcers and diseases such as cancer, colitis, and diverticular disease. When you assess the patient, inquire whether he has experienced blood in vomit or stools. Blood that passes in vomit can have either a bright red or coffee ground appearance. Bright red blood in the emesis indicates that the blood flow is fast. If the emesis has the appearance of coffee grounds, it indicates that the blood has been altered by partial digestion.
Do you have a history of anything like this?
Be aware that a relatively small amount of blood in the emesis can appear enormous to a patient. This can greatly increase the patient's anxiety and heart rate.
How about your stools? How do they
Blood that passes in the stool can have a red, maroon, or a black tarry coloration, depending on the location of the problem. Ask the patient whether blood that has passed was pure blood or whether it accompanied the stool.
Okay. And do you have any medical history that we should be concerned about?
Ask the patient if he has a history of gastrointestinal bleeding or any known gastrointestinal disease. Be sure to look for signs of shock early on in any GI bleeding patient. To manage gastrointestinal bleeding, activate EMS and take standard precautions. Assess and monitor the ABCs. Be alert for vomiting and be prepared to provide suctioning if needed. Provide oxygen if permitted by your local protocol. If the patient's breathing is inadequate, assist with ventilation. Assist the patient into a position of comfort. Usually this will involve lying on the side with the knees drawn up. This position is also better for airway management if vomiting is likely. Do not give the patient anything by mouth and treat for shock, even if signs are only in the early stages.
Whatever's the most comfortable for you.
Provide reassurance. Keeping your patient calm helps to reduce anxiety and stabilize vital signs.
It started this morning.
Okay.
Take a look.
Abdominal injuries can be extremely serious and life-threatening. Damage to internal organs can cause severe internal bleeding that can quickly lead to shock. Damage to a hollow organ, such as the intestines or stomach, can cause their contents to drain into the abdominal and pelvic cavities. Not only can this cause a significant amount of pain, but the danger of sepsis or severe infection in the abdomen is high and can lead to septic shock. Common signs and symptoms of abdominal injuries are an open wound to the abdomen, pelvis, or lower back, indications of blunt trauma to the abdomen or pelvis, pain or cramps in the abdomen or pelvis, guarding of the abdomen, and a rigid, distended, or tender abdomen. If you suspect a penetrating injury, such as a gunshot wound, be sure to look for an exit wound. Also be aware that serious damage can occur to surrounding tissues, not just in the direct path of the penetrating object. If the injury includes an open wound, control the bleeding and dress the wound. If there is an exit wound, it will likely be more serious than the entry wound and should be treated first. To manage abdominal injuries, activate the EMS system. Maintain an open airway and administer oxygen if permitted by your local protocol. Assist the patient into a position of comfort.
Okay.
Usually this will involve lying on the side with the knees drawn up. Treat the patient for shock and continually monitor vital signs. Expect that there may be some vomiting, which the patient could aspirate. To limit the risk of vomiting, do not give the patient anything by mouth, even if asked, and be prepared for suctioning. 2 other examples of serious abdominal trauma you should be prepared to treat are eviscerations and impaled objects in the abdomen. An evisceration is an open injury to the abdomen in which organs protrude from the wound. If the patient suffers from an evisceration injury, do not try to replace the organs. Soak a thick dressing with sterile saline and cover the wound.
We're going to go ahead and just apply this over here just to keep it sterile. We're just going to put an occlusive dressing.
Apply an occlusive dressing over the moist dressing if your local protocol permits it.
Can I have some bulky dressing space?
Cover the occlusive dressing with additional dressing to preserve warmth. Bandage the dressing in place above and below the evisceration using tape or cloth ties. Provide care for shock and do not give the patient anything by mouth. If there is an impaled object in the abdomen, do not attempt to remove it. The object could be sealing a damaged blood vessel. Removal could cause sudden, serious blood loss and further injury. Instead, expose the wound, cutting clothing if necessary. Avoid touching or disturbing the object if possible. Control any bleeding by applying direct pressure around the object. Be careful not to apply pressure to the tissues along the edges of the object.
To the wound itself.
It may be necessary to stabilize or secure the object. If it is long or heavy, you may need to hold it in place. Other objects can be secured by laying bulky dressing along the long axis of the body and along opposite sides of the object. Hold the dressings in place, then stack additional dressing perpendicular across the previously placed layer. Continue to layer the dressings until the object is stabilized.
All right, we're going to go vertical with these again. I'll go into that side. Okay, some pressure.
An alternative method is to cut a hole larger than the object in the dressing and lower it carefully over the object.
Excellent, thank you.
Use tape or cloth ties to bandage the dressings in place above and below the location of the injury. Do not give the patient anything by mouth. Provide reassurance. Keeping the patient calm will help stabilize vital signs while you wait for additional resources.
You're doing good, your vital signs are great. We're just going to keep...
Injuries to the abdomen are among the most serious you will encounter. The abdomen can be the location of multiple life-threatening traumatic injuries and diseases that can lead to significant pain and bleeding. Without proper emergency care, these conditions can quickly lead to shock and death. Proper training, however, can help you manage these conditions and stabilize patients until further help arrives. In this program, you have seen the signs and symptoms of acute abdomen. You have seen how to assess and provide emergency care for patients with acute abdomen and abdominal pain. You have seen the causes of gastrointestinal bleeding and how to assess and manage it. You have seen common abdominal injuries and their signs and symptoms. And you have seen how to provide emergency medical care for eviscerations and impaled objects. Abdominal emergencies require immediate medical attention. When you respond to an abdominal emergency, your skills and quick action will be the key to providing appropriate emergency care to save lives.
Get some tape and stabilize it.